can follow the wheel with me on this side. We started with defining the question at the top, moving to searching, doing an efficient search of the literature, and now we're moving on to critical appraisal, step 3. And the critical appraisal piece is trying to find the best evidence that exists about a particular clinical issue or an issue related to a public health intervention. It's not about finding only randomized trials or systematic reviews, but it's about finding what's the best evidence for decision making. In the critical appraisal area, we've developed a tool called the Compendium of critical appraisal tools for public health practice. And when we looked at the literature, there are about 90 to 100 now different tools for helping you figure out what's the best evidence in a particular area. So what's the best study design? Was the study done well enough that you could be confident in using this information in your decision making? The kinds of information we used for deciding which tools to put into this compendium was that we were wanting to find tools that were freely accessible, so didn't have to pay for using them, tools that were particularly relevant for public health practice and decision making, and tools that were easy to use, so self-explanatory. So for that reason, we chose a number of the CASP tools. CASP is a program in the UK called the Critical Appraisal Skills Program. And the CASP tools sometimes look a bit daunting. Unlike other tools that are one page and look very short and efficient, the CASP tools have taken basically worldwide accepted criteria for different critical appraisal questions and have an explanation about the criteria and where to find them in most studies. The way the studies are published, there's kind of a format. As you get more comfortable with critical appraisal, you can figure out where to find the answers to those questions and where the critical appraisal exists. So in the CASP tools, we have divided the tools that exist according to sort of here are some examples and here's the recommended tools. And we've put them in order of quantitative questions, so questions like what's the effectiveness of a particular intervention, questions about causation, about prognosis, and then some systematic reviews. Then we've also found some tools about guidelines, critical appraisal of guidelines. Again, there's worldwide agreement that the tool that is best to use is something called the Agree tool, and that's also freely accessible and gives you quite good explanations for how to assess the criteria that they're asking you to assess to make a decision about whether or not to use this guideline in making recommendations for practice. And finally, there are tools about qualitative research. How do you critically appraise qualitative research? In this area is much more cloudy than the guidelines or criteria for systematic reviews or criteria for intervention studies. I think because there are several different types of qualitative research and there just hasn't been the same kind of worldwide gathering of people to make decisions about what are key criteria in qualitative research. So again, we've offered a few different tools in the compendium, and we have also made a recommendation about which we think might be the easiest and best to use in public health practice. So you'll find this compendium for critical appraisal on our website, www.nccmt.ca, and I hope that you'll explore these tools and find some other useful things on our website.